Thank you so much for this interview. I had the opportunity to meet the Minister of Health to discuss the situation in the country with regards to the overall Mpox preparedness and response, collaboration with Unicef, how we are supporting the government's efforts at all levels. We are very impressed and pleased to see the efforts and the leadership from the national government being at the ministerial level, but at all levels, at the clinics that we have visited, also at the community level. Everyone is very committed and the coordination is strong. The commitment that I have seen also of the health workers have been very strong, and I think it's all together, all hands on deck. Unicef has been supporting the government to really put in place a response plan, and we are working at both levels of response and prevention. I visited yesterday the Prince Louis Clinic, where Unicef is supporting one of the isolation centers, where we have seen with a lot of concern, majority of the cases of Mpox are children at almost 60%, but they are taken care. There is also the process that is being put in place. It is reassuring that also health workers are protected, but also children and mothers are also supported to get the care not only related to Mpox, but also any other related disease that the children can come with. UNICEF also is supporting the government to ensure that the essential services are continuing, not only related to Mpox response, but also all other essential services like routine vaccinations, nutrition, but also very important to note that we have just opened the school, and we are supporting the government to ensure that the learning, there is a safe learning, so the school are continuing to remain open and the children are learning about the Mpox, also with support of hand washing and other activities as well. There is a lot of support that is taking place at the community level, especially raising awareness about Mpox, raising and having discussions about the modes of transmission, but also how to protect and specifically focus really on the hand washing and other activities that are safeguarding the well-being of children and families. We are also supporting the people, being children or mothers that have had, they have been tested positive, to raise their capacity to go back to communities and talk about the Mpox, so that they can be the message, they can send a message about how to protect, but also to fight the stigma and make sure that they are reintegrated back into the community and ensuring their well-being as well. So we had a very, very good discussion. There is a lot of work to do, and I also want to thank the government at all levels, interministerial work that is taking place, multi-sectoral intervention that is taking place as well, and the donors, of course, that are supporting UNICEF and government into this response. We are looking forward to scaling up our response to Mpox, but also to scaling up, more importantly, the prevention to this, which is going to help us really cut and contain this outbreak and limit the impact to children and families.